Hi, I'm Dr. Dan Shapiro. I'm a board-certified plastic surgeon certified by the American Board of Plastic Surgery. I've been practicing in the Scottsdale Paradise Valley for over 21 years, and today I'm talking about a common question that's asked of me with regards to facelifts, and that is, how long does a facelift last? The answer to that question is multifactorial. I think we have to look at someone's habits. I think we have to look at their genetics. I think we have to look at whether their face is thin or heavy. And that all goes into the equation, along with what sort of facelift that I do will give an indication of how long a facelift lasts. First of all, I think you have to understand that when we talk about how long a facelift lasts, it's different for everybody, but I think that you are setting back the clock and you will continue to age more gracefully than had you not had the facelift. So when a facelift is quote unquote not lasting anymore, it's not like all of a sudden you look old. I think you'll continue to look younger than you had you not had the facelift. So I think that you have to develop some new habits and continue to age gracefully. So the different kind of facelifts that I do, the first is a mini facelift, which uses only skin to elevate the cheek area, and that is basically doing this in the mirror. That is a good procedure for people that don't have a lot of skin laxity, don't have heavy jowls, and their neck looks relatively good. And who is that person? Generally people between 35 to 50, let's say, with moderately good skin elasticity, generally not smokers, and generally not a lot of sun exposure. Now, the nice thing about a mini facelift is other procedures can be done with it at the same time, and that can be done in the office, whether it be having your eyes done, laser resurfacing, fat transfer. So that whole package tends to last longer had you not had that done with the mini facelift. The other procedure that I do is a more comprehensive facelift, and that's called a smash facelift. And when I do that procedure, I'm actually elevating the deep tissues of the face, which include the muscles, the fat, and the skin. That procedure is more elegant, it addresses the neck, and that tends to last longer. It's difficult to really put a time estimate on that because everybody is different. Some people have a history of smoking, some people have had significant sun exposure, some people don't have full bone structure. In those patients, it tends not to last as long. And in patients that have the other situation with no sun exposure, no smoking history, and beautiful bone structure, it tends to last longer. So what is that time frame? Generally we say around 7 to 10 years, more towards the 10-year frame, and longer in patients that have better habits coming in. There are things that you can do to prolong the longevity of facelift, and that is doing changing the habits, stop smoking, have less sun exposure, using retin-A and bleaching cream, and then augmenting that with some maintenance therapy, and that would be some fillers, whether it be fat, having laser resurfacing, whether it be dual therapy, which is a non-invasive skin tightening. Many things can be used to prolong the length of time that a facelift lasts. And all you have to do is come in and we'll talk about it and find out if you're a good candidate. Thank you.